Japan stands as a unique case study in the field of geriatric medicine, but statistics alone do not tell the full story. As a physician, what truly astounds me is the visible, functional reality of their elderly population. Imagine walking through a park in Okinawa and seeing a 90-year-old woman drop her gardening shears or a coin. Instead of groaning, bending over with a stiff lower back, or looking for a handrail to stabilize herself, she descends effortlessly into a full squat to retrieve the object and rises back to a standing position without needing to grab a bench for support. That specific movement, the ability to lower one's center of gravity and rise against it without assistance at that age, is a medical anomaly in the modern world. It represents a level of joint mobility and lower body power that we typically stop seeing in Western patients after the age of 50. The data suggests this is not merely a genetic advantage, as Japanese individuals who adopt Western sedentary lifestyles lose this protective benefit. Therefore, the secret lies in specific biomechanical habits embedded in their daily routine. We are going to analyze 6 of these protocols today, proving that, if there is a method, you can replicate it. But before we examine the physiology, I would like to welcome you. Please introduce yourself in the comments below and tell me which city you are watching from. If you have specific concerns about your mobility, leave them there as well. I read through them personally. If you are new to the channel, please subscribe and share this video, as we are about to discuss information that is vital for your long-term independence. Let us address the first biomechanical difference immediately, which explains that fluid movement in the park, the concept of the resting squat. In Western preventative medicine, we are increasingly viewing the chair as a significant contributor to orthopedic decline. In contrast, Japanese culture utilizes the deep squat as a standard position for resting and daily tasks. From a physiological standpoint, we refer to this as active resting. When you sit in a chair, the posterior chain is disengaged and the hip flexors shorten. However, a deep squat forces the hip joint through its full range of motion, maintaining the elasticity of the joint capsule and the flexibility of the Achilles tendon. A study conducted at the University of Tokyo highlighted that individuals over 70 who maintained this squatting habit possessed leg torque comparable to 50-year-olds. This is because the position itself acts as a natural pump, aiding venous return from the legs and stimulating the digestive tract through gentle compression. However, as a doctor, I must urge caution. If you are over 60 and have not performed this movement in years, your joints are likely not prepared for the load immediately. You must approach this with proper progression. The correct form requires the heels to remain flat on the ground to ensure the weight is loaded into the glutes and not the knee ligaments. If your heels lift, do not force the position. For my patients, I prescribe a supported variation initially. Hold on to a stable door frame or heavy furniture. Lower yourself only as far as you can while keeping the spine neutral and heels down. Start with just 20 seconds. You are re-educating your nervous system that this position is safe. As you gradually increase this duration to 2 or 3 minutes, you are effectively reversing the stiffness that leads to immobility. This foundation of flexibility allows us to move to the second critical factor, neurological stability or balance. In my practice, I find that falls are rarely caused by a lack of raw strength, but rather by a delay in proprioception, the body's ability to sense its position in space. The Japanese incorporate single leg balance into everyday activities, which keeps their vestibular system sharp. A 10-year longitudinal study on elderly Japanese subjects revealed a remarkable statistic. Those who practiced daily single leg balance reduced their risk of hip fractures by 60% and their overall fall incidence by 40%. This exercise targets the gluteus medius, a crucial stabilizer muscle on the side of the hip that often atrophies in older adults. When you stand on one leg, you force this muscle to engage rapidly to prevent the pelvis from dropping. To do this safely, stand near a wall for support. Lift one foot slightly off the floor. Elevation height is irrelevant. Stability is the goal. Keep your hips level and avoid leaning your upper body. Start with 10 seconds and aim for 1 minute. You are building the reflexes necessary to catch yourself during a trip, essentially fall-proofing your body. Building upon that neurological stability, we must next address the issue of structural strength without causing joint trauma. This brings us to a specific isometric protocol known as the horse stance, or kibadachi. In geriatric care, we often struggle to find exercises that build muscle without grinding down the cartilage in the knees. The Japanese solution is isometry, creating muscle tension without movement. This wide stance squat is particularly effective because it isolates the adductors, the inner thigh muscles, and the quadriceps in a way that stabilizes the pelvic floor. When you assume a stance approximately 1.5 times your shoulder width and sink your hips as if sitting in an invisible chair, you create a structural arch that strengthens the connective tissue around the knee joint. Clinical research published in the Journal of Physical Therapy Science has shown that elderly practitioners of this stance experienced a 24% increase in leg strength after just 12 weeks. The key to this exercise is weight distribution. It must be perfectly equal between both legs, and your knees must push outward, aligning with your toes, to prevent valgus stress on the ligaments. You should feel a distinct burning sensation in the thighs. This is the accumulation of lactate, a metabolic signal that triggers the release of growth factors to maintain muscle density. I recommend starting with short holds of 10 to 15 seconds. It is safer than heavy weightlifting for the elderly spine, but provides a similar stimulus for muscle retention. This strength creates a solid base, which is necessary for our next intervention regarding how we move through the world. We move from standing still to the mechanics of locomotion with a technique often referred to as sampa, or mindful walking. As a physician, I observe that many elderly patients develop a shuffling gait, where they barely lift their feet, drastically increasing the risk of tripping on rugs or uneven pavement. This Japanese practice is essentially gait retraining. It involves slowing your walking pace down by a factor of 4 to actively concentrate on the biomechanics of the foot strike, heel, midfoot, and toe off. While often practiced as a meditative exercise in Japan, medically, we view this as a dual-task training exercise. You are forcing the brain to consciously control a movement that is usually automatic. Studies on Japanese adults over 65 utilizing this method showed a 50% improvement in circulation to the extremities and a significant improvement in dynamic balance. By walking this slowly, you are forced to spend more time in the single leg stance phase of walking, which demands higher engagement from the core and ankles. I advise practicing this in a hallway at home. Focus entirely on the sensation of your foot rolling across the floor. This heightens your proprioception, your body's internal map of where your feet are, which is the primary defense against stumbling in complex environments like crowded streets or gardens. However, a strong gait requires a strong engine, which leads us to the second heart of the body, the calf muscles. The gastrocnemius and soleus muscles in the lower leg are responsible for pumping venous blood back up to the heart against gravity. Weak calves in the elderly correlate directly with poor circulation, ankle swelling, and varicose veins. The practice of heel raises is a non-negotiable daily habit for maintaining this pump. Mechanically, this is simple plantar flexion, but the execution matters. You must rise onto your toes, pause at the top to maximize the contraction, and lower slowly. The tempo of the heel raise is where most people fail. Bouncing uses momentum, not muscle. For my patients over 60, I emphasize high-volume repetitions because the calves are endurance muscles designed to work all day. Performing 2 to 3 sets of 20 repetitions, perhaps while brushing your teeth or waiting for the kettle to boil, creates a functional stimulus that stabilizes the ankle joint. This directly translates to an improved ability to climb stairs and walk on uneven terrain without fatigue. It is a small movement with massive cardiovascular and orthopedic implications. Now, for those watching who may have osteoarthritis or knee pain that prevents the deep squatting we discussed earlier, we must have a clinical alternative. This is where the wall squat becomes essential. By placing your back flat against a wall, you remove the demand on the lower back and reduce the shear force on the knees, making it a purely muscular challenge. You slide down until your knees are at a comfortable angle, ideally approaching 90 degrees, and simply hold the position. This isometric loading strengthens the quadriceps tendon, which is the primary support structure for the kneecap. Studies involving older adults have demonstrated that regular wall squats can improve stair climbing ability by over 20% in just 2 months. The wall acts as a safety net, allowing you to push your muscles to fatigue without the fear of falling. Ensure your knees remain stacked over your ankles and do not collapse inward. Start with 15 seconds. The shaking you feel is not a bad sign. It is your nervous system recruiting dormant muscle fibers. It builds not just leg strength, but the mental resilience to endure and manage physical discomfort, a trait highly valued in Japanese culture for healthy aging. Finally, I want to leave you with a bonus protocol that acts as a reset button for the entire skeleton: the dead hang. While this is not a leg exercise, it addresses the compression of the spine that occurs as we age. Gravity is constantly pushing us down, dehydrating our spinal discs and causing us to lose height. Hanging passively from a bar reverses this process. It allows for spinal decompression, hydration of the intervertebral discs, and, crucially, it maintains grip strength. In geriatric medicine, grip strength is a potent biomarker for overall longevity. A strong grip correlates with a strong heart and reduced mortality risk. Furthermore, this passive suspension restores overhead shoulder mobility, which many seniors lose, limiting their ability to reach high shelves or comb their hair. You simply grip a bar and let your body weight pull you down, keeping your feet on the floor if necessary to control the intensity. Relax your shoulders and breathe deeply. This releases tension in the lats and thoracic spine. If you have severe shoulder injuries, consult your doctor. But for most, this is the most effective way to counteract the hunched posture of modern living. By integrating these 6 methods, the resting squat for hip mobility, single leg balance for fall prevention, horse stance for safe strengthening, mindful walking for gait mechanics, heel raises for circulation, and wall squats for knee support, you are not just exercising. You are building a biological shield against the aging process. Consistency is the medication here. Start slowly, use support, and listen to your body. If you found this medical breakdown helpful, please subscribe and leave a comment below. I look forward to seeing your progress.